it is the second most cancer in women. And to say about cervical cancer, I can show you, this is the uterus. This is the bachadani, where the baby occurs. This is the cervix, which is seen from below. So this cervix is called cervix of the uterus, and it is the commonest cancer in women. 1 decade back, it was the first cancer in India, but now it has become second. The breast has come first. But the fact with cervical cancer is it is not detectable, and it is coming in a last stage, and moreover, it comes in like a stage 4 disease where we can't offer them anything. Looking into the, what we can say, the figures, which is always blows our mind. So cervical cancer, if you see in India, 1.2 lakh cases occur, and out of that 70,000, nearly 50% die because of cervical cancer. So that dreadful this disease is. And whenever this disease starts, whatever we say, the infection starts, there is no complaint. There is nothing happening to the women. So women think, I'm fine, why should I go? And when the symptoms occurs, it is a cervical cancer which has developed into third stage, and that is when women come in and we can hardly offer them anything. So that is the way it is very dreadful. One should understand the cervical cancer, why it is happening. We have to understand the fact. It is happening because of a virus which is called an HPV virus. Okay, and that HPV, if you see the full form, it is a Human Papilloma Virus. That is an HPV virus. This infection occurs to each and every human being. I'm not telling female, each and every human being, men and women, in their lifetime. And this virus spreads through contact. Okay, it is skin to skin contacts. So it is not necessary, because if you are not active, you don't have this virus, but you can have this virus anytime. This virus infection occurs in a younger age, and in a very elderly, after 20-30 years, you get this virus is a carcinogenic. It will convert the cells into cancer. So what is happening? This virus, whenever it is in your body, it will not cause any symptoms. And so the detection is not occurring. But world over, it is said that women who are screened regularly, they hardly have this cancer, and they are saved from this cancer. So it is not necessary that you have symptoms. You don't have any symptoms, you should not be screened. It is necessary for each and every woman to undergo cervical cancer screening from the age of 21, which is universally followed. See, there is the non-sexual transmission also. So sexual transmission, even with the first act, you may get the virus. Even with multiple acts, you may not get the virus. We don't know how this virus transmits, but skin to skin contact is there. So instead of finding how many partners you have, or what your partner is having, how many partners, you are 21 above, you should get your screen. Nothing is related to sexual activity. It is non-sexual way also of transmission. We have seen HPV virus on the skin of the perineum region, that is a private part. So these viruses are there. So instead of looking into your activity, it's better to get yourself screened. And you are a monogamous relation or you are a multigamous relation, this virus infection is there. You can get it from anywhere. You can get it from fomites thing. Like if you are using washrooms, you are using bed sheets, if you are going to a gynec examination, you are going sonography, you can get a virus from anywhere. So it's better to get yourself tested rather thinking about it. Pap smear is, what is a pap smear doing? We are inserting one type of instrument from here, and we take a sample from here. It's a gold standard technique which has been used since last 50 years in the world. It was invented in 1943, and it has been very effective method where we take the cells, and these cells the cell sample is taken, then it's sent to the laboratory, and in the laboratory the cytopathologist see the abnormality in the cell, the virus which has caused damage, it is seen, and he will report it. In future, this lady may develop into cancer. There are certain abbreviations, there are low-grade lesions, that all is reported on pap smear. The fact with pap smear is it has been very effective worldwide in developed countries, but it has to be done every 2 yearly. So it has a call recall method. In a country like ours, we have been failed in pap smear screening. The main reason is huge population. You need to screen so many. If you can consider the women population of India, it is around 400 crore. So you can imagine so many women to be screened, so many cytopathologies, too many hospitals was not there. We lacked in infrastructure, we lacked in government organized screening, and hence the pap smear was been not that effective in our country, but world over it has been very effective. It is not painful because what is happening, a small speculum is kept inside. People may think that is painful, but who has gone normal vaginal delivery, they will not feel pain. So it's a very small or simple method which can be done in the OPD. Now what we are having an HPV test. That is, we detect the virus instead of cells. And HPV virus detection, the beauty of is that if you are detecting the virus and if you are not having the virus infection, your report is negative, then instead of doing every 2 yearly, you can do it every 5 yearly. That is the benefit of HPV. It's more sensitive than pap smear. Secondly, it can be a self-test also, a simple small swab which can be put into your vagina, and such type of test can be done. Here I have a chart. It can be done by herself, and probably this will be the answer for our country where women don't have time to go to the doctor. So there are different methods of testing. There is an HPV self-test, there is a pap smear, but whatever, you have to get yourself screened. That is the take-home message from this talk.